Chapter 13, Question 1, which states, why is it challenging for clinicians to narrow down the autoimmune disorders at play and how is it diagnosed in the end? A quick overview, autoimmune diseases are when we cannot determine between self and non-self, which is also known as self-tolerance. And that's when the T cells attack our own tissue because they become sensitized and they attack the antigens within our own body tissue. And there's type 1, 2, 3, and 4 autoimmune disorders. It's hard to diagnose these because there's a wide range of diseases. There's variability within symptoms. It's difficult to be 100% sure which diagnosis is completely accurate, and symptoms can vary in time developed. So they can become very quick and acute, or they can be latent, or they can be dormant within the body for many years and not show up till later. And these type of tests, you often have to do multiple tests for each, and they're more wide range tests. So they're tests that can be used for they're not just specific to autoimmune disorders. And a lot of autoimmune disorders have symptoms similar to other diseases that aren't nearly as serious as them. For an example, I'm going to walk you through how to one method to diagnose Graves' disease, which you can get the physical examination. Now, this is the easiest one to conduct. You're going to look for symptoms such as protruding eyes, which is exophthalmos, goiter, which is the enlargement of the thyroid gland. Those are two telltale signs of Graves' disease. But you can also get an ultrasound done, imaging, blood sampling, which is pretty unanimous throughout any testing for autoimmune disorders because you're looking for inflammation and immune response within the body, and if it's attacking its own tissue, as I mentioned earlier. You can also get iodine stains and radioactive iodine imaging as well. And that's just a few tests that could be used to diagnose this disorder.